Hey, what's up, guys? Just want to give a quick update on my wrist, what's going on. It's been almost, I got this in 2018, April-ish. So it's been about almost 3 years, 2.5 years. Uh, getting close to 3 years, like 2.75 years. But, um, yeah, this is basically, uh, my wrist. I kind of want to just talk about uh, some stuff that's going on. Complaints, uh, zero. I haven't had any issues since the surgery. Um, None at all. That's my other wrist in comparison. But yeah, no issues. Range of motion. I think I've already kind of demonstrated my max, so not too much side to side, but going downwards, I did actually get a little bit more motion than what I showed on my last video. At least I feel like I did. Uh, I was able to go all the way down and then up. Basically, could go all the way up. I think I measured at like 80, 78 degrees. So I'd say that I was very fortunate to get about, I would say, 80% of my motion back. I'm very happy. Surgery was 10 out of 10. I really can't complain. I did see a comment that talked about arthritis. Uh, I have no issues. I haven't have felt like any ligament bone issues since then. Like I might occasionally once every like 3 or 4 or 5 months, I might get like a little throbbing on my wrist, but that might be because I extended it a little bit too far, but it's very rare. Like I would consider it almost negligible. Grip strength, pretty good. The one thing I want to talk about grip strengths when getting this surgery, the PRC surgery, is that you have to keep working out afterwards to maintain that strong grip strength. If you stop working out, then I noticed that my grip strength was exponentially getting weaker. So that's something I to be considerate on it on the surgery, to consider. So if you were to get this surgery, you have for in my opinion you have to keep working out to maintain a strong grip strength like your other hand. But and if you don't, then it exponentially gets weaker. In my own opinion, that is. But that's kind of like just a trade off, with these kind of things. Um, but that's it. I mean, good straight. I would consider myself fair, like average, good. Um, I stopped working out a little bit, but I should be going back to it. And every time I do, like I mentioned, it just gets back to normal pretty quick. Um, and yeah, that's just how it is. That's basically it. Scar tissue, or like if it hurts around where the surgery scar is, none, zero. But you know what? I did kind of notice this hand. Actually, it's not really doing it right now. But I work with a lot of electronics, and when I'm soldering, and all that stuff, I do notice that this hand's a little harder to keep still, like slightly harder. Although it's not doing it right now, it's quite random. Yeah, it's not doing it at all. Okay, but it's like kind of random. Maybe it's just me. Maybe it's just my mind. But yeah, I do notice his hand's a little difficult to keep still, whereas the other one is a little. It's no issues. But yeah, post in the comments. Um, I'll see if you guys have more questions. I'll answer it the best I can. I'm not a medical professional, so uh, you know, I'm just sharing my experience. All right, thank you guys. Take care, and best of luck with you and your endeavors.